Hello, everyone. My name is Ran Schwarzkopf. I'm a professor of orthopedics here at NYU Langone Health, and I'll be speaking today about our JBJS article named Tranexamic Acid is Safe in Patients with a History of Coronary Artery Disease Undergoing Total Joint Arthroplasty. A little bit of a background: tranexamic acid has been shown to be a highly effective method for reducing blood loss and the risk of transfusion for total joint arthroplasty. However, many patients with coronary artery disease and coronary stents have been excluded from receiving tranexamic acid due to fears of cardiac and thrombotic events. At our institution, like in many others, anesthesiologists and surgeons sometimes opt to administer TXA in select cases of this patient cohort. We therefore wanted to determine if TXA was a safe and effective method for blood loss management in a patient cohort who is otherwise thought to have a contraindication or a relative contraindication for administration of TXA. While we found that patients with coronary artery disease or cardiac stents were not at an increased risk of VTE in comparison to our institutional rates due to the use of TXA, it was surprising to discover through a sub-analysis that the method of administration did not affect VTE rates as well. Although the sub-analysis was not fully powered, these findings set an interesting precedent for future studies about the systemic effect of different TXA administration methods. TXA has played a key role in preventing blood loss in total joint arthroplasty, but many surgeons and anesthesiologists are hesitant about its use in patients with coronary artery disease and coronary stents due to fears of VT events. Our results should help to ease some of these fears, especially if the only contraindication is a history of coronary artery disease or coronary stents within 6 months prior to surgery. Patients with these contraindications should not necessarily be excluded from benefiting clinically from its use and the benefits that TXA give for blood loss. However, our results are from a retrospective cohort study and therefore recommend future and further research and prospective trials to confirm the safety and efficacy of TXA use in patients with coronary artery disease and coronary stents, as well as to determine the safest administration method. However, this study lays the groundwork for future studies of a patient population who has traditionally been removed from TXA treatment, and hopefully these patients can clinically benefit in the future from these blood management methods. I thank everyone, and I hope you enjoyed the article.